Hi, everybody. Jack O'Malley coming to you from the basement bunker. Hey, a couple things. On Monday, I mentioned that during our COVID Oversight Committee hearing, Dr. Khaldun said that this week the Health and Human Services would come out with new guidance for indoor visitation for long-term care facilities. Well, today they did. And there are, some restrictions and some guidelines to here and there, but they are now going to allow indoor visitation in certain areas that have, lesser COVID issues and whatnot, and the safety of each individual building. So my suggestion is give your long-term care facility a day or two to figure out what all this means, and then you should be good to go. But I would call them and make sure they're good before you just show up saying you want to see Granny or Grandpa, okay? Just to be on the safe side. Give them time to figure it out because it's confusing, and then call ahead to make sure that they're ready and just to be respectful because this has been such a mess. So there are rules in place now for indoor visitation. Call ahead, make sure they're prepared for you, and I think you'll be good to go. So today, I want to talk about today. I think it's the biggest thing is that I was out raking leaves. I've been busy going, and I got leaves up to here, so I'm out raking leaves. So I put the headphones on, while I got the leaf blower going. And I'm listening to the radio, and on comes some doctor from Traverse City. It was one of those political yappity yaps. And he's basically going on about how the Republicans don't have a plan, but yet they're criticizing the governor. She's a saint, and she's saved lives, and the Republicans are just mean SOBs. So I got steam coming out my ears, coming out from behind those headphones. Because we do have a plan. And I'll take you back a little bit, back to when all of this was happening. If you remember, been following along, we worked with the governor until somebody whispered in her ear, I think you can screw him over with the 1945 law. And then things changed, right? Until the Supreme Court said, no, the 1945 law as you interpret it is unconstitutional. Sorry, Madam Governor. But back then we did have a plan. We said, look, let's do this regionally and safely to allow businesses to reopen. And the governor told us, take a hike. She ignored us. She ignored our plan, which made a lot of sense. And I think in hindsight was proven right because we kept these businesses locked down much longer than they needed to be. I can go on and on. You already know my thoughts there. But we did have a plan. So right there, the good doctor from Traverse City has got his head up somewhere. So I move forward. Tuesday, 6 of my colleagues presented the Michigan House of Representatives Comeback Roadmap. They did a fantastic job. Basically what this does is it mimics, I think, our earlier plan of let's be regional because certain parts of this state are different. Population-wise, you bet COVID was running rampant. It isn't the exact same as say, my Benzie County, population's just different. It makes sense. Let's do it regionally. So what this plan basically does is it says, look, if counties follow the metrics and they keep their cases down, let them have their own local rules. Let them make sure that they can do things their way because each county is different, right? Negaunee and Houghton County is different than Oakland County, and Benzie County is different than Wayne County. So let's allow our locals to have some input. What an idea. Regional, safe, smart. So, but there would be metrics. Now, here's part of the problem. Before the governor, what's your science and data? We have science and data. That's all you need to know. Can we see the science and data? Remember when our representatives sent a letter to the governor, not once, but not twice, saying, can you give us some of these metrics here, some of these answers? I checked. Never got replies to those letters, right? Other states that have been opening successfully have said, here are the metrics you need to follow, which I think makes sense because when people are just told to blindly follow, they get upset. They don't like it. Why? Right? I used this example once before. I'll use it again. The Israeli army, I read this years ago. The Israeli army did a little test. They took a battalion or a troop of guys and said, you're going to march from point A to point B. They took another group and said, march. Didn't tell them where they were going. The group that knew its destination marched quicker, more succinctly, and did it in much better time and got there in much better shape. The group that was just told to march kind of meandered, didn't march as efficiently, and was kind of whipped when they got there because they had no idea where they were going. That's the point. If people have a plan, if they know the plan, if they know leadership knows what in the HE double toothpicks they're doing, they'll follow it better. And our governor wouldn't do that. Arrogance? I don't know. Doesn't trust us? I don't know. But when we'd ask for science and data, I've got science and data. That's all you need to know. Right? So what does the Republican comeback plan? So this good doctor in Traverse City, if you're listening to me now, blow it out your pie hole, buddy. Here's the idea. You give people metrics. And if they stay within these or below these metrics, that county can go differently than the state rules. Isn't that an interesting idea? If they fail and go above, now they have to go back to the state mandates. It makes sense because we are headed into the flu season. We are headed into, people are getting back inside. The case rates are going up, but our hospitalizations are those sorts of things. I've read an article today that said, holy smokes, we've learned so much more about this disease and this virus that when people are in the hospital, they're getting out quicker and things are happening because the doctors know what to do and what, more importantly, what not to do. So we move through this. Any situation we're in today could be bad. I'm not going to sit here and fib to you, but it isn't going to be like it was 6, 7, 8 months ago because we know so much more. Do we know it all? No, but we know so much more, right? So we can't compare spring to fall, but we still have to be careful. So all of you ready to pounce on me, I didn't just say, la, 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 la. We got to pay attention, but we also need to be realistic. So here's the plan. It's pretty dang simple. There are thresholds. Case rates, the number of confirmed cases based on population over a 14-day period, 55 cases per million. If you stay below that, you're all right to move forward. Positivity rate, the rate of positive tests over a 7-day period must be below 5%. And I think we're at 3.8? I think it was, I saw maybe 4 as a statewide average. But think about a county. It might be a 1, who knows? Sufficient hospital bed capacity. Hospitals are able to manage a certain percentage surge in admissions or patient transfers. They need to be able to handle a 20% surge and no more than 25% increase over a 14-day period. If hospitals are in that position, we can loosen things up in that region. Sufficient PPE supplies for over a 14-day period, 2-week supply. They got to have that much on hand. Makes sense. PPE is much easier to obtain today than it was 8 months ago. Remember, we've got different situations than 8 months ago, 7 months ago. And ability to trace and test for COVID-19. They need to be able to test 15 people per 10,000 per day, have that capacity with a turnaround of 3 days or less in testing in the labs. If you can get into those thresholds, we're going to allow local communities to behave differently than the statewide mandates. Give people buy-in. Give them a reason. Okay, I get it. Oops, we're getting a little close there. We all better watch out. People will know, just like that Israeli army troop. If they know where they're marching, they'll march better. So here's the crazy thing. Trust the people of Michigan. But yet they all aren't wearing masks. We've said it before. I'll say it again. If you expect 100% compliance on anything, you're nuts. I used the example of the seatbelt law on Monday, right? People are dying in car crashes. One of the reasons is, they're not necessarily wearing their seatbelt. That law is 35 years old, and Michigan only has a 94% compliance to seatbelt. We're one of the highest in the nation. National average is 90% compliance. But those laws have been around for 30 plus years, and we still don't have 100% compliance. That's the way it is. So when I say the state is only caring for the COVID patient, they're not caring and thinking about everybody else. Maybe their intentions are good. I won't argue that. But their methods are lacking. And when I asked the other day, I'll repeat it because it stunned me. Do you know the suicide rate in the state of Michigan this year compared to others?
No, we don't.
It's October and you don't know how many people are committing suicide? You don't even have a round ball figure? Nope. They don't know the whole patient. Anecdotally, I'm hearing all over that suicide rates and suicide attempts are up. But our state government, who's making decisions on how to handle things, don't even pay attention or know how many people are killing themselves because of all of this. That tells me they are not handling the situation correctly. So maybe it's time that the governor lets the legislature in to bring some new eyes to this whole situation. So I commend my 6 colleagues that really went to work on this, worked with doctors and scientists to discuss, all right, how do we do this? And they came up with this plan. It is so simply logical. I'm sure it's going to take the governor's staff a week to figure it out. Because if it ain't complicated, they don't know how to handle it. So if you sense a little sarcasm in there, go ahead. Because I've talked to enough of the department heads through our COVID oversight committee to know these people are focused on what they don't want to hear from anybody else. And that's unfortunate. So that's why we've got to force this in there. Call the governor's office, write her, Jack, I have, it hasn't done any good. Well, keep them coming. Tell the governor, listen to the Republicans. We have co-equal branches of government. You got to listen. So to that doctor in Traverse City, to you, you're full of it. To the rest of you, have a good night. We'll see ya. Bye-bye. That wasn't nice of me, was it? I take it back. No, I don't. Good night.